could you say more about intravenous iron? I had a blood panel done a couple years ago where my hematocrit was low, so I've been taking iron bisglycinate, I believe, for a year or two since then, but still feel especially anemic at times. I'll mention that I don't eat any meat and don't get a lot of carbs, so I don't eat like fortified grains or anything like that. So yeah, curious why you mentioned intravenous iron.
IV iron is basically a year's worth of oral iron in one dose, and it just goes basically straight into your bone marrow, and you have iron stores that last a year. And people report feeling amazingly better, like almost immediately. I take that kind of stuff with a grain of salt, but it's a pretty common response. I would say if your blood count is low, there's a whole workup for that, and it's not necessarily an iron deficiency as the cause. So I wouldn't want the iron to mask any underlying cause, but assuming low iron is your issue, yes, it saves a lot of hassle, and it's very effective, but pretty expensive. You basically talk to your primary care doctor, you say that you want this IV iron treatment, how much it's going to cost, how much your insurance will pay for is unclear, so try to work that stuff out ahead of time, and then they essentially, you book an appointment in an infusion suite in the U.S. anyway, and you show up, they put an IV in your arm, the infusion takes definitely no more than an hour, might be a half hour or less, and then you're good to go.
Aaron, to recap, you're saying that most healthy people don't suffer vitamin deficiencies, and that except for prenatal vitamins and people with certain specific medical needs, the vast majority of people do not need to supplement. And in fact, we're probably over supplementing. My question for you is this. You mentioned calcium, but I knew a child who took the jar of good tasting vitamins and ended up with an iron overdose. Are there any vitamins or supplements that you would caution us really to dial down and pay attention to dosages? I know fat soluble vitamins often don't leave the system. What specific vitamins could be harmful if somebody over supplements with them? I'd appreciate anything that you have to say about that. Thanks. Also, Diana, you may have some thoughts on this as well.